today's town hall is really a chance for us to kind of share with you what's been happening inside of our department. So we wanted to kind of contextualize what changes we've been making, the system impacts that have been happening with our department, the caseload issues, the caseload increases, and then walk you through our overall budget as we move into a more detailed conversation around the TSN investments and how it really fits in with the community as a whole, the agencies that we funded, what the plans are going forward. Then we have a couple presentations by Ann Tapp from Safehouse and from Suzanne Crawford from Sister Carmen that are going to present to you too. And then we're going to open it up for a forum for feedback from you all and suggestions, comments about how we should head in the next year, what you think about what we've shared. So preliminarily, I think we're hoping that this will take about 45 minutes of presentation so that we'd finish by 7 and then have, maybe 45 minutes to an hour for discussion. That sounds good. All right. So just to kind of remind everybody, our department is the Housing and Human Service Department. Our department was merged in 2009. Former Housing Department and the former Department of Social Services were put together by the Board of Commissioners on January 26th of 2009. And we restructured ourselves and created a new mission. And our basic goal is to promote safe, healthy, and thriving communities. And we're dedicated to supporting and sustaining those healthy communities that strengthen individuals and families while promoting human dignity and hope for the future. So everything we present today, we're really trying to kind of show you how it links to that overall mission. And today's presentation, I will do some of it, and then Jennifer Eads is going to go through the Self-Sufficiency and Community Support Division and work, and then Kit's going to go through the work in our Family and Children's Services Division, and then we'll kind of dovetail back into finance and budget issues. So one of the things that we wanted to kind of review with you all and the community was when we set out with the merger, the economic downturn had started, but it really wasn't a driving force in the merger of the two departments. The departments were really merged from a sense of strategic imperative that had really come out of almost a decade of community planning processes. So when you go back and review all the community plans that have happened in Boulder County really since the early 2000s, they've continued to show sort of repetitive themes throughout them. The need of the community to have easier access to services, for it to feel less siloed, for things to be more integrated, for people to be able to access what they need sort of in a common and easier entry point. And so all of that strategic work that has happened across systems, and it's very similar concepts, whether you're looking at services for older adults or for families and children or for individuals with disabilities or for individuals who have experienced homelessness. All of that really informed our process leading to the merger of the two departments. And when we merged, we kind of tried to set out some guiding principles as to what that merger, how we were going to approach that merger, and how we were going to approach any decision that kind of hit us as part of that merger, which many of them in the first couple years were very significant funding challenges from the state level, big budget cuts that we had to deal with, big shifts in federal funding at the federal level. And so we were very thankful, honestly, that we had set out some of these guiding principles to move our way through those decisions. So these aren't all of them, but we wanted to just kind of give you a sense of how this has informed our last few years and ties to our investments with the TSN money. We really made a very early decision that we were going to move as much of our system upstream as possible, that we were really a front-end early intervention, prevention-oriented system, and that our responsibility and the safety net as a department is so significant, touching so many tens of thousands of people, that we really had a responsibility to the community and the taxpayers to move our system to that level. Otherwise, we knew we would be unable to meet the needs in the right way, that we would be really sort of a back-end system that very costly, a lot less people can access it in an easy way, more people falling into crisis. That we were, of course, going to focus on promoting the safety and well-being of children and families that touch our child welfare system. That we were really going to change the the culture around accessing family stability benefits and moving towards self-sufficiency, that we were going to move toward that as one of our primary pillars of early intervention and prevention activity. And you'll notice how that has really shifted, and it has really been an important strategic shift that the department made. And that we were going to really build off of the Human Services Strategic Plan and continue the work on integrating services, that all the research shows how successful an integration of services can be in forming a front-end prevention system. And it's really what the community's been really asking of us for quite a long time. We also, after doing a number of assessments of our department and really talking to the community a lot, began to figure out how to enhance both our community and family engagement. And one of the ways I personally like to think about this is we've really tried to turn our department back over to the community. So we've really tried to see ourselves as simply facilitators of the community governing itself in a new way. And I really take that role really seriously, and I know we do as a leadership team. And by that, what we mean is, we are just a vehicle for our community finding a way to provide services to itself and to govern itself. And the more we push those services and our engagement with the community to that level, the easier it is for our governance to really reflect the values and needs of the community. So we've tried to incorporate those principles of family engagement throughout our divisional work and our community work in a totally different way. We've also tried to shift from, a lot of the programs that we administer have a culture of sort of regulation and can often have a sense of a punitive nature to some of them. It's just sort of inherent in the way some of the programs have been constructed. And we really focused on how to shift that to a different level of customer service to provide those services to the community as opposed to making it more difficult for the community to access those services. And then, of course, we've been focusing hugely on how to make our system much more efficient and much more of a business operation that learns from itself, operates in a different way, reduces overhead, provides more dollar for dollar out into the community for services and less for infrastructure and less for siloed communication, siloed services. And then we've been working hard at how to communicate and be more open as a department. How do we continue to engage this process where our department is really seen as owned by the community, and we are a really transparent operation and becoming accountable ourselves to that community feedback. So these processes have really helped us kind of move through some of the most difficult decisions I think many agencies have had to face in the last few years. They've been incredibly challenging decisions, but these have really helped sort of shape our path through them. So now I'm going to turn it over to Jennifer Eads, and I've had the pleasure of working with both Jennifer and Kit through this whole process, and they are two incredible people. And if you don't know them, please get to know them. But their ability and their talent and their knowledge in their service areas and in the whole department is really incredible. And we've really found a way to move our whole system to be more thoughtfully built together and for each impact in the different divisions to support the work of the other divisions. So they're going to walk you through some of what we've been doing in each of these areas. So Jennifer?
I think I've said this before. Clearly it's easy to follow Frank as a leader, but it's really difficult to follow him as a speaker. But I'm really thrilled to be here and to talk about the work that we do. I love my job. I love what we're about. I love what we're about as a community and as a department. And as Frank said, we've been through this systems transformation that's very iterative, and it's continuous. And what we try to keep at the forefront of all the workers in our departments and in my division is to really keep first and foremost that we need to help all individuals and families have easeful access to health coverage, food stability, financial assistance, housing supports, and any of the case management supports that are going to lead to self-sufficiency, that we can, if we keep that in the forefront, we open up venues for families and individuals to have a much different experience. And that, I think, helps shift the work that we do and the way that we deliver our customer service. So the division I lead with this team has several different divisions in it. We have the Community Assistance and Resource Services, and that's about 90 staff that help process all of the food assistance, financial assistance, Medicaid, LEAP, and all of the outreach and enrollment texts in the community. And I'll show you in a bit just the magnitude of work that they produce on a daily basis. The second division is Family and Resident Support Services, and that is child support, enforcement, and establishment to really help provide that self-sufficiency benefit to the child for a lifetime. The Child Care Assistance Program, so the CCAP program. Family Self-Sufficiency, which is a Section 8, 125 units of Section 8 housing with supported case management that has a focus on employment and education that will lead to long-term family self-sufficiency. Housing Crisis Prevention, which I'll talk a little bit more in detail. Housing Counseling. Casa de la Esperanza, senior housing, and then our investigations and recovery unit that is really about fraud prevention. And then we have a lot of special programs. What's been really great about us as a community and what we've been up to around integrated services is that it's really allowed us to take a statewide leadership role. So within my division, I house the statewide training team for the Colorado Peak project, which is an online application. So our staff helps work with the state and has trained over 1,000 community-based partners around the state in how to use the Colorado Peak tool. We also have volunteer services, the Medical Home Initiative, and Healthy Communities, which helps link low-income kids who have been enrolled in Medicaid and CHP Plus navigate the systems and find a medical home so that they're getting the preventative care that really leads to, you know, all the kind of good outcomes that we know happens for kids that have access to health care. Over the last few years, we've seen tremendous growth. If you look at 2008, we were at 6,700 food assistance clients and just almost 20,000 Medicaid clients. And over the recession, we're up 2.5 times in food assistance to around 16,000. Sometimes that peaks to 18,000 depending on the month. And then in Medicaid, we're at 31,000. So 1 in 10 Boulder County residents is receiving Medicaid right now. And that's just a significant caseload increase. For food assistance, it's 140%, and in Medicaid, it's about 55%. And that's, I skipped the slide. I was getting too far ahead of myself, which is normal. And in addition to these increases that you see over time, we're also seeing a lot of people who don't qualify. And so we're processing a lot more applications. So our workload is up because people are really doing whatever they can to get access to the benefits. So in addition to the increased applications that are resulting in resources and benefits being provided, we're also seeing an increase in families who are coming in and not eligible, and so the workload is sort of compounded on both sides of that. At the same time, we've been doing continuous quality improvement and business process reengineering internally within the department to be able to take care of those caseloads. So even though our caseloads increased in some programs 140%, we increased our staffing through 1A by 10 people, which is about maybe a 20% increase in staff to take care of about 120% increase. But simultaneously, we were working on the harvesting the great ideas of our staff and really re-engineering the way that we do business. And we've been able to increase our timeliness in the applications being processed. So there are federal guidelines around how quickly you process an application. And in December, we were the second best in the state. And that state average was 75% of applications being processed timely for Medicaid, and we were at 90%. And that's actually 90% is low for us. We're usually about 93, 94. So we've been doing a really good job at being timely during the recession as well. There's a really interesting other aspect of food assistance and Medicaid, and that's really the economic development aspect and the amount of funding that comes into the community to help stabilize folks during the recession. So if you see in 2008, we were just around $11 million in food assistance coming in to the county per year, and we've increased that by about $15 million. So it's almost $3 million a month in food assistance or food stamps, and most of those are new families, new poor, who are being affected by the economic downturn and unemployment, the unemployment issues. But meanwhile, we're able to kind of stabilize the families and provide this funding for the economy, the local economy. And then our Medicaid has gone up steadily despite provider cuts, as we all know has happened. In addition to those kind of hard benefits, those federal entitlement benefits, we've been working with our community partners since 2008, since the recession, in trying to stabilize families through housing crisis prevention. So families who may just be experiencing a short unemployment period or just a short-term economic crisis, and being able to stabilize those families and individuals in the homes that they are renting, and not having the sort of costly child welfare interventions and the costly, the cost to rehouse. So over the last 4 years during the recession, we've helped over 1,000 clients, families stay in housing and stabilize, therefore not becoming homeless. And so we did that as sort of a national precursor in 2008 using local TANA funds, and Frank was really instrumental in helping the state secure a lot of ARA funds for housing crisis prevention, rapid rehousing, and it's been such a major asset and resource to the community and the need is still there. All of our community partners are talking about this need, so we're using a lot of 1A dollars because the ARA funding has expired, which you might see in the next slide, or I might be sort of ahead of myself again. We can go ahead. So this graph just shows sort of where we started in 2008 with local dollars, and then the 2011 is when the ARA funding came in, and without 1A we would drop down to only having about $200,000 this year to serve low-income families in housing stabilization. So we're filling that gap, which will be at about 250 families not experiencing homelessness. Additionally, what we've done is really marry the housing crisis prevention program with the housing counseling program. So financial literacy, budgeting, basic sort of economic education, and really redesigned the program to include case management and a financial literacy component, so that families can not only stabilize in their housing but have a plan to be able to sustain that after the 3 to 6 months of funding is made available. And again, we were facing a budget cut, even though this was one of the most effective programs that we have around foreclosure prevention and housing stabilization. So we're using some 1A funds there as well, but that would have been cut. We would have had to cut our staff despite the caseload increases in that. So a little bit of the impact of the expanded outreach. You did see the numbers. What's not in the numbers is sort of the difference between us and other counties. And during the economic recession, all counties saw a pretty dramatic increase. But in Boulder County, we were seeing about 20% more than our counterparts in the Big Ten. And for me, that means success. That the Medicaid average is about 45% over the recession for family med increases, and it's 65% in Boulder County. And that means that our outreach efforts and our community partnerships are working, that we're finding more eligible but unenrolled kids and getting them into care, and that helps stabilize the community clinics, that helps stabilize the families, that helps stabilize the education outcomes. So that, I think, is something to be very proud of. Additionally, we've created outreach portals in the community. We have technicians stationed at both school districts, Clinica, Salud, our center, Sister Carmen, and EFA, just trying to find the families who are new to having to deal with poverty issues, and who might not understand their link to us. And so we're kind of getting out into the community and finding them. Go ahead. Yeah. I'm done now. But I love my job.
Thanks. So, and I love my job too. So in Family and Children's Services, some of you know that when we did the merger of the two departments, we engaged with Casey Family Programs, who is the national expert in child welfare work, to do a comprehensive assessment and give us some suggestions about how we can go forward with best practice nationally. And at that point, they were pretty excited to engage with us, because usually they're called up when there's been a lot of child deaths or really serious bad stuff happening in child welfare. And we called them up and said, we're doing pretty good, but we think we can do better, and we really want your help in pointing us in the right direction. So that was an incredible process, and they're still engaged with us. And it's been a real gift to us and to the community, I believe, because they gave us many recommendations that have really helped us improve our service delivery and the services that we're getting out to families. So at that time, part of what they recommended was a reorganization. At that time, we had 3 offices in the county, and each was managed by a different manager. And as you can imagine, that led to really differences in the kind of practices that were happening in Longmont versus Boulder. And we just really didn't have a consistent approach to our practice. So we reorganized into 3 divisions that are each headed up by one manager, so that there's consistency across the county for that kind of practice. So we have our intake unit where all the referrals come in, and they're actually even centralized in one office so that they could really build that consistency and the approach to the front end. And as you may know, we get far more referrals than we really go out on assessments for, or that we open as cases, that there's kind of this winnowing process as we look at the referrals that come in. Not all of them are legitimate child welfare referrals, but they may be something that we really want to give some resource and referral to all of our community partners, and that may be the most appropriate intervention. And that's certainly what we're growing in that unit now. And so I'll be talking about that in a little bit more. And then we have an ongoing. So when a case is opened and it becomes a case, then we have one manager over all of the ongoing workers, so that there's a consistent approach to how we're working with those families and how we're helping to get them connected with all the resources that they need. And our third unit is the Family Engagement Unit, and these are the workers that work on adoption, foster care, kinship care, life skills in the home, and all of those other services that we have internally that our families really need. We also have under my umbrella the Adult Protection Services, so that's services for vulnerable adults in the community, whether they're vulnerable because of their mental status or their physical status. And so that group is also connected with intake. They do their own intakes and go out on those cases. And then we have a partnership with our Impact Partnership, which is the collaboration with all the public agencies that serve our highest risk children, youth, and families. And it's been a deep and long-standing partnership that has really reduced duplication between agencies, filled in the gaps between agencies, and integrated our services much more deeply. So there are a lot of integrated teams that are a part of the Impact Partnership. And this shows you what's been happening with us in terms of referrals during the recession. So you can see that we have steadily ramped up in terms of the number of referrals coming in as families are struggling more, both financially and emotionally as a result of the recession. And this one shows you that actually, even though we've had an increase in referrals, we have had a decrease in open cases in kids and out of home. And the reason for that is because of all the other front-end services that Jennifer talked about, that if we can get those kind of hard services into families, if we can stabilize their housing, if we can get them food assistance and get their kids Medicaid and all of those things, then families can stabilize, and they don't necessarily meet the threshold for a child protection kind of case. And so we we're really excited to see these kinds of interplay between the two parts of our organization that are really supporting these families most deeply, or three parts because of the housing. And so you can see this in the numbers. And we have also, the out-of-home piece, we have worked actively on. This is one of the initiatives that we've worked with Casey Family Programs on. We had, when we first engaged with them, we had the lowest out-of-home placement rate for any of the Big Ten counties. So we were already working on how do we keep kids and families together in their homes and in their communities. And Casey has given us some other ways of approaching it that have allowed us to even ramp down even more. So we're really happy to see those kind of numbers. So some of the successes, it's actually to date a 57% decrease in out-of-home, and in December we had only 80 kids placed out-of-home. So we've been able to keep them with their parents and with their family members instead of having them in those kind of places. We also had a reduction of 17% in open cases from 2008 to 2011. And we already talked about the referrals that have gone up in spite of all of that. And we have had an 18% increase in adult protective services open cases. So that team has really strengthened a lot over the last couple of years and have been outreaching to the vulnerable adult population and working very closely with a lot of the community partners that also serve that population and getting at those families or those individuals the services that they really need.
Can I ask a question? What's the caseload of adult protective services these days?
It's
approximately.
I think it's about 25.
25. Okay.
Yeah.
It's per person, per worker.
Per worker. Yeah.
Per worker.
Yeah.
How many total for the department? Right.
I didn't bring that with me.
How many, excuse me?
How many
Adult, how many are on the caseload of adult protective services? Ballpark.
Oh, caseloads. Yeah, great.
And I think the caseload is actually a little bit higher than the 25. I think we'll have to get that back to you, but I think we're, more in the upper 30s.
So just didn't know the sense of scale.
It's a lot smaller than that, ongoing caseload. I think it's in the ballpark of, if I had to guess, ongoing cases is probably about 100, 110 maybe, somewhere in there. So you can see, we've just tried to give you a little bit of a snapshot as to some of the things that we've been doing, and the way that we've really achieved some of these successes has been to reorder our system and try to develop a better, more flexible continuum of services. So we've really been focusing on, sort of the concept of dosage for families and level of service. One of the things that was pretty apparent when we have done some of our internal assessments was, depending on what door you came to our agency, it was not uncommon for you to either be underserviced or overserviced, and that's a common occurrence throughout our entire community. So by that, what I mean is oftentimes the family issue that first presents, the portal that the individual or family first touches, is the one that they maybe have the easiest connection to, the closest connection. It's familiar to them. It's in a school. It could be in a community center. It could be in one of our partner agencies, or it might touch in our system a lighter touch service or a deeper end service. And as a result, you can often end up having an individual move from sort of silo to silo, or in some cases receive multiple case managers, and in sometimes that pans out with sort of a deeper back-end service model that has to be deployed when an easier front-end model could be. So some of the specific ways that that's played out in terms of us sort of moving our system upstream is, we've been realigning our housing continuum. So our housing service continuum has been sort of moved into a different kind of pipeline. So what I mean by that is all of our systems are built on a certain level of capacity, and usually capacity gets reached in our system long before we meet community need. But the key really oftentimes isn't making the pipe itself bigger. Sometimes it's making the pipe bigger, but other times it's that the pipe doesn't get clogged up. And that what that means is that the right amount of service has to be provided to keep people moving through our system, so that they aren't sort of ending up holding up the system, where then people just start backing in, and we get a sense as an agency or as a community of an incredible backlog of unmet need. So some of the ways that's panned out in our housing system is, you could see how we realigned and deployed a bunch of resources to use the housing stabilization, which is sort of a little bit of a lighter touch. The case management is done by our community partner agencies, and it's rent assistance for between 4 and 6 months. Then we've turned housing units to meet specific social problems. So we have housing units directly accessible now to our Family and Children's Services division, where they are the only ones that can provide access to those units. So an emergency short-term housing unit for a child welfare involved family, where housing stability would decrease the likelihood of placement. We have some of our units being deployed in partnership with SPAN for some domestic violence families in some similar situations. And that also allowed us to apply for 50 family unification vouchers from HUD. So we just received an allocation this July, and those 50 vouchers can only be used to either prevent a family from having their children placed out of home, or to promote family reunification and return of the children, or for a youth who's aging out of care. And those are big resources, and the important part from our learning has been the segmentation and allocation of those resources in a continuum, so that we can try to move families through that. And it frees up some of our agency partnership resources as well to serve other populations. It also allows us to free up some of our own internal resources. So, by example, many of the families that might have ended up in our family self-sufficiency program really are more appropriate for all the resources I just described at early stages. And that allows our family self-sufficiency program not to be backed up with individuals that are less likely to succeed in that part of the continuum. And we've tried to look at each system in that same way. So it is really an upstreaming of our system that we're really focusing on. And I think you've seen us do that sort of consistently in a number of areas, and I'll talk about how that links to our TSN investments. So this is just some brief, big picture numbers of the budgets that we have and sort of what they've been subject to. Our Housing Authority budget, which is a component unit and enterprise fund of our department, the operating base budget for 2012 is around $18 million. And then the construction of our Josephine Commons project this year, which started in August, we have about $8 to $8.5 million of construction this year. So, approximately $26-27 million within the Housing Authority is budgeted for an expense this year. And then on the human service side, it's about $34 million in base operating. So this doesn't include the numbers that you saw on EBT payments. So there's a tremendous amount of resource that ends up in the community through the Medicaid pass-throughs and the food assistance pass-throughs and old age pension and aid to the needy disabled and all of those things. And the reason we put those slides up is, there's federally accepted multipliers of the economic benefit to the local community of each dollar spent through those programs, and they're pretty significant in what they bring to our local pharmacies and grocery stores and medical clinics and hospitals. And the benefit of accessing those during an economic downturn is it's a little bit easier to ramp up and ramp down with those kinds of those flows of dollars than some of the other things that we try to build to mitigate downturn. So here are some of the challenges that we continue to face. You've heard me speak and us speak about some of the budget issues that we've faced federally and statewide they've been quite a lot for us to surf our way through. And we just wanted to point out one of the things that we kind of deal with almost on a daily basis, both from our department and the commissioner's office in terms of what's happening with the TANF funding statewide and federally. So right now, these are our projections of what level of reductions we're looking at in TANF statewide over the next, we're already halfway through 11-12. So in the next 2.5 year total reduction, you're looking at a $59 million statewide reduction in TANF. So, you know, TANF, temporary assistance for needy families, is the replacement to the old AFDC. So in 1996 it transferred to TANF, and it's the most flexible block grant of dollars that our department receives to support the community. We can contract with a variety of nonprofits to meet TANF eligible purposes. It can be used to supplement our child welfare budgets and our child care assistance budgets. And just to kind of put that into perspective, Boulder County is about 5% of the statewide allocation of resources. So $60 million would roughly translate to a $3 million reduction. There's also, you know, a possibility that we could continue to see very significant reductions in our child welfare financing, up to 23%, or some of our projections. We already received and had to budget for an additional $500,000 in child welfare cuts in this current state fiscal year that we're in. So, you know, some of the things that we have to plan through, and we don't just see these as things that we have to brace ourselves against. You know, I think our department has tried to work with our commissioners and the community to really seize the challenge and the crisis of the downturn to move our system forward, and not to just feel, I think, you know, victimized or in a difficult place by the budget cuts. And so we don't really see all these threats as just problems. We try to solve them and figure out what other resource we can do. And I think our partnerships with you all and in the community and the support we've received with the TSN money has really supported that process and allowed us to knit ourselves together. But we know that this is going to continue. I mean, I don't think that there's any illusion that we have around some of the difficulty that we'll face. Some of the stabilization that we've seen in state general fund money has just been replaced by instability at the federal level, which, you know, none of us really know where that will pan out, but certainly something we all have to be thinking through locally over a multi-year period. So what this basically says, a lot of words on there, is that we've really tried to shift our system in a new way. And you know, one of the analogies I like to use lately is to sort of link ourselves to our environment. You know, we see ourselves as a real ecosystem, our department as an ecosystem, our community as an ecosystem, and sometimes I think we like to think that we're so divorced from the natural world in the way that we operate, but our agencies really don't function devoid of ecosystem principles. And when you look at sort of the dam removal projects that are happening across the country, I like to compare what we're doing in human services a little bit to dam removal, in that, you know, 15 years ago, if you said you wanted to remove a large dam on a river, you were really considered a lunatic. You were considered a crazy environmentalist. There was no purpose to that process. You know, what were you going to do? Risk the community, risk not have energy source. And now it's commonly accepted that we should be removing dams on rivers, that they don't make sense. And so a number of dams have been removed, and across the country, and some of the biggest in Washington State. And on the Elwha River is one that if you haven't seen the video, go on YouTube and search some of these and watch them removed, because it's beautiful to watch actually them come down, because they break and all this sediment and crap just comes pouring out of the bottom, and it just looks horrible. And then after a little while, it starts to wash itself clean, and you start to see the river start to go back to its natural source. And on the Elwha River, you know, currently there's 3,000 salmon on the Elwha River. So the dam's been there for 50 years, and only 3,000 salmon left. And with the removal of the dam, they anticipate that there will be 3 million salmon back on the Elra River. And I like to think of a lot of times our agency work, it's not so much doing something differently as taking a barrier down and letting the sediment wash out. And I think a lot of the community work that we've done together is really barrier removal to allow families and ourselves to sort of more naturally swim upstream, sort of easier to home. So, for 50 years the salmon have been just diving into this concrete barrier because they know they're supposed to be upstream, and there's only 3,000 of them left. And all we do is take it down, and they know exactly where to go, and there's going to be 3 million. And sometimes I think the way I've seen our system shift together has been the same process. It's, we take a barrier down, and we start to all think, oh, yeah, that's common sense, actually. Let's take another one down and see what happens. So on the TSN side, we put a big ballot initiative together, temporary human services safety net mill levy. It was approved by the commissioners to kind of move forward in early 10 and was passed generously by the voters in November of 2010. And the basic mission of TSN is to stabilize funding for human services programs throughout the county, both in our county agencies and in nonprofit partners, and it can be used at a 0.9 mill levy for time limited for 5 years, and then it expires. And the commissioners have the authority to move that mill levy up and down annually, and it is deposited in a temporary safety net fund, and then we sort of bill and contract through that separate fund each year. So last year you saw us go out into some community meetings, and what we had done again was we didn't want TSN to be a planning process. There's already plenty of plans in the community in multiple systems, and we looked at all of them and identified these top priority areas. And what we have done since then is to systematically look at each of these areas and try to begin to push money and services and shift our system to affect each one of these gap areas. And here's some of the timeline that's been underway with us. The ballot passed in November 10, and we began investing in ensuring that people had access to the stability benefits that we talked about. We released first round of funding out to the nonprofit community in February, March of last year. We put some additional resources into the housing stability program. We released a second round of RFP for additional services contracted out in the community in December. Those contracts began December of this year. And we've begun assessments and have budgeted for about $1 million additional resources to go into 3 additional areas: emergency services contracts that are underway, parent ed and transition age youth services. The round 2 contracts continue for 2 more years, those services that are under contract there, and then we'll be looking at that round 3 contracting later in the year, as well as the child care investments that we do through TSN. So here's some of how that money has been spent thus far. The first round of funding was awarded to these incredible community partners to service the economic downturn to those amounts, and this was again February of 2011, about $500,000. Round 2, what we did actually this year in our 2012 budget, the ballot designated $1 million a year that would go out to nonprofits, and what we actually budgeted for this year was to move $2 million out to the community, to the nonprofits. So we budgeted to double that amount of money. And in these amounts, so what you're seeing here is a 2-year contract. 2-year contract amounts to these agencies for these services, and this is again one component above the emergency service dollar amount, as well as the designated placeholders we have for funding for transition age youth and parent ed to come. In addition to those dollars, here are those additional investments from the round 2 of emergency contracts that have gone out. as well as the Housing Stabilization Program resources, which are case managed by those community partner agencies that we listed in both the first slide and this slide. So really, the way that we like to look at the TSN money, or one of the ways we like to look at the TSN money, is there's about $2 million in contracts with about $1 million plus in additional resource through housing stabilization. So we're trying to push approximately $3 million through those processes out to the community portals to meet the emergency and contract needs of those 9 identified gap areas. So, do people have questions about those? I don't want to go too fast through all of this. Or I can jump into some of these remaining funding areas. So one of the things we did when we went through those 9 priority areas, some of them were pretty easy to RFP for and to work with a community agency on and to designate money immediately because the community had identified the needs. There was great case management and planning around those areas where coming together and sort of refining how those processes needed to be improved could be done sort of in shorter windows of time, and those investments could be deployed. And then a couple areas we sort of had to hold back for later, and one of them is parent education and parenting skills. And I think this one is an interesting one because we have a lot of parent education around the county, but we don't have a sort of a consistent level of planning and approach to what we're trying to achieve with parent ed, and how to do it collectively. And when you talk to the school districts, which we've been doing sort of proactively from the Impact Partnership, where the Impact Partnership is looking at moving some investments of our back-end service model to truancy reduction, which is a high predictor of deep system involvement in detention, placement, et cetera. So as we've been having those discussions with the school districts, this keeps presenting itself as well as a big problem in the schools, and we certainly face it in our department in terms of how to provide the right kind of parent ed for the needs that they have at the point. So we're working on some of this to go forward, and we have budgeted for money to be expensed on this through the TSN project over the next couple of years, but we don't have it finalized yet. So we anticipate this going out at some point in 2012. And same with transition age youth, and I know Kit can speak to this as well, but Casey Family has offered some national resources both inside and out of their shop that are going to come meet with our staff and help us sort of think through our transition age service model. You know, we have a lot of pieces inside of our department, and there's a bunch of pieces out in the community that touch this area. And there's been different groups that have come together across the county to try to focus on what would this look like. We know many of the same pillars that are successful with our families are the same exact ones that are needed for transition age youth, but there needs to be a little bit more thought and assessment on this. And this is starting in February. Yeah.
So Frank, you're just talking about kids transition out of foster care, or is it a broader population?
It's both. So it's a specific focus on many of the youth that are at risk of aging out of foster care, because we really are trying to reduce the chance that any will, and then it's just that whole population of youth in transition at that time, and really how that touches both the school districts. It touches our substance abuse issues across the county, touches some of our teenage pregnancy issues. So we're trying to look at it both specifically for the population you described and then overall. Okay. Overall, our community impact, I think, through these investments and the realignment of our department and the TSN money, the things that we've been successful at is really providing increased access. The TSN money has been used immediately to provide additional community-based portals for mental health services and case management services, dental aid services, and housing support. We've also begun the standardization of screening and assessment and a really strengthening of the common language among agencies around what that means in terms of what really will support our families in a deeper way. We've also increased the access of community-based family resource services for at-risk families. So one of the things you saw us put out in the RFP this year was a really well-known national evidence-based model is family resource schools or family resource centers. And basic principle being to push many of our governmental services out into easier to access, less stigmatized community service portals and create that partnership between what nonprofits do and what governments do and how we can support one another. And a lot of the services that we've talked about can get integrated at those community service portals. So we're working with City of Boulder and Sister Carmen on that project. And I think the other thing that's important that we'd just like to emphasize is the investments of TSN have also helped us position ourselves as a community to figure out future resources going down the road. So FUP being a good example, family unification vouchers being a good example. We've been approached by the Division of Housing to focus on homeless youth reduction in the schools and to consider taking on a tenant-based rental assistance program in partnership with the school districts. So some of those things can also be explored because we are doing the system work that we're doing. Let's see. I think we've talked about all of those. And here's another data point. The amount of money that went out to provide emergency food assistance in our nonprofit partners translated to about 760,000 meals served over the last year. Okay, I'm going to turn it over to Suzanne Crawford, who is one of our stellar community partners. She's the CEO of Sister Carmen Community Center in Lafayette.
Hi. So Frank covered so much of the detail and stats. I thought you might enjoy hearing a story. Maybe enjoy is actually the wrong word, but I feel that the story that I'm going to tell you will illustrate a little bit about why the temporary safety net funding has been so essential and such a godsend for our community. Last Friday, I happened to be filling in at our front desk because our office manager took a rare day off. And so I sat at the desk for about an hour, and I happened to be the person that answered the phone when a woman named Linda called. And she had been to our food bank for the first time earlier in the week, and our intake specialist had referred her to call for an appointment to meet with one of our support services coordinators. I'm going to digress for just a moment and explain that support service coordinator is the term that we use that's equivalent to case management, but we really believe that people aren't cases to be managed, and so thus we changed the name from case manager to support services coordinator. Okay, back to the story. Anyway, so she had been referred by one of our intake specialists to call and make an appointment to meet with one of our support services coordinators to explore other resources that we might have available for her. And I got to talking to her on the phone, and she told me that she is a mental health therapist and had been working in the field successfully and raising her two boys who are both in high school, and had lost her job about 6 months ago and had been searching for new employment since then and had not been able to secure employment. So over the course of the 6 months, and this is a single parent, by the way, the father is not in the picture and is not providing child support for whatever reason. So over the course of the 6 months that she has been unemployed, she has been searching for work, raising her sons, and frantically trying to figure out how to keep making their mortgage payments. And her rental payments, because they rent a house. So she came to our food bank for the first time. She'd always lived in middle class. Her family, her parents were middle class. Their parents were middle class. She's never had a problem before, never sought services, and finally ended up coming to our food bank out of desperation, basically, because she had gone through her entire life savings. She had gone through all of her retirement savings and had started selling off her furniture. They literally had just sold their dining room table to help pay the rent. They had already sold some of the boys' bedroom furniture, and it was this desperate of a situation. And I tell you this story because these are the folks that we're seeing at the Sister Carmen Center now. Sure, we're still seeing the low-income folks that live in our community who always had a day-to-day struggle to survive because of the cost of living here and the low wages that they're making. But these days we're seeing more and more people who have never had to ask for assistance before. And it's traumatizing to them to come in and ask for assistance when they've never been to an agency like ours. And we really, really try to make it a warm and inviting experience for them. I know that sounds funny, but we really try to make them feel welcome and supported when they're in our center. And so Linda is not alone. This is happening more and more and more. The people that we're seeing are coming from middle class, or they've had their hours cut and they're underemployed and struggling to survive, so they're having to come for services for the first time. So it's a pretty sad situation. And it's not like it happened overnight. We started seeing increases in clients, dramatic increases probably started in 2007 or 2008. But last year, between 2010 and 2011, we saw a 28% increase in demand for food bank services. I tell you this because there is absolutely no way that agencies like ours could have kept up with that increase in demand without the taxpayers of Boulder County generously passing 1A. There's just no way that we could have done it without this extra funding. And so I guess for me personally, I'm deeply grateful to the taxpayers of Boulder County because you're allowing us to help so many people that we might possibly have had to turn away. So that's all I'm going to say. Thank you. And by the way, I love my job too.
And now Ann Tapp, also one of our stellar community partners, is going to come up and speak to us, and she's the Executive Director of Safehouse Progressive Alliance for Nonviolence.
Thanks, Frank. Will, thank you so much for all the work that has been done, I think, to create both the opportunities that the TSN has provided, and then all the work that the partner agencies have done to actually make it work. I keep thinking of this story, which is not as poignant as Suzanne's, but I think it's kind of funny. So I was raised Catholic, and everyone who knows you say grace before meal, so everyone knows that. Bless the Lord, these are gifts who brought you to Christ, Lord, amen. You all know that? Okay, so I went over to my youngest brother's house for dinner, and his little 4-year-old. So we're saying grace, bless the Lord, and at the very end, Adam goes, and for justice and liberty for all, which was great. And I thought, well, they should actually incorporate that into the prayer. But what it made me think is that how routine we are in our lives, and that for Adam, he was merging two routines, the grace and the Pledge of Allegiance. And so anyway, maybe you have to be Catholic to appreciate that. I don't know, but I do think that it is one of the things. Whether the metaphor is breaking down the dams and surviving the sludge that comes down and believing that there actually will be a clearing of that, or other routines that we get into as far as how services are delivered, how agencies do our work, how we connect with or don't connect with each other. I think it's those routines that in some ways are some of the largest barriers that we face as a community. We have enough need here. We have more need than we can oftentimes respond to. But we also have I think visionary leadership in the work that the county does and the nonprofits in this community. So we have a recipe to actually do things differently. At SPAN, one of the things that we discovered, we were actually in 2009, even before all of this great stuff came to fruition, we were one of 5 domestic violence organizations in the state that were selected to pilot a co-location project. So we co-located one of our advocates at TANF and Workforce in Boulder County. And to just throw some numbers to that, in 2009, we had received 10 referrals from the TANF Workforce office in Boulder County. Even though at that point, 91% of our shelter clients, and there were 395 folks in the shelter that year, 93% earned less than $10,000 a year. So we had this huge need. Obviously, the vast majority of shelter clients should have been eligible for TANF benefits. Even though we were making referrals, we weren't getting. We got 10 back, sort of 10 back. We started this pilot project, the co-location project, and last year the referrals from TANF into our shelter were 150. And one of the things that we've been able to do with the TSN money is to actually be much more effective in then linking those clients back into whatever services that they're eligible for, to sort of set the stage for access to housing. It costs, in 2010, there was a study done at the state to look at what is the cost, how much does it cost, and what's the cost savings if a victim of domestic violence or survivor is able to move out of the violent home, reestablish a safe environment for themselves and the children. So the savings back to the community is it's $9,470 or something, so almost $9,500. So with the $71,040, I forget how come we came up with that amount, but it's $40 well spent. $71,040 that we received from this community through taxpayers' willingness to actually contribute. All we would have, of the 72 folks that we connected into eligibility services through Peak Online, of those 72 folks, if only 7 of them were able to, through that support services, stay in safe, stable housing, the community saved itself that investment. So I think it is one of the things, one of the messages that we want to be able to communicate back to our community, is that these funds, well, they're meeting a need, a human need, in some ways sort of a moral obligation. They're meeting a need that we as a community are responsible for, are accountable for. But equally, they are saving the community long-term dollars in long-term expenses. And I think that message is something that maybe in this next phase, as we start to really profile and really look at the value added through these funds, we can take that message back to the community, because I think it's very significant. Liberty and justice.
Next one. Okay, so some of our next steps, and these are just sort of strategic areas that we know we're going to be focusing on, is continuing our partnership on system change, ensuring community access points are open, really continuing with our assessments and really aiming investments toward where those assessments lead us. Building a much more coordinated service delivery system and strengthening our safety net. Focusing on some training and technical assistance across the county, and really building those financial stability plans, sustainability plans, stability plans over the next few years, because this is our second year at TSN, so we've got basically 3 years and 10 months to work our way through the downturn and continue to integrate and get stronger and figure out what resources are needed going forward. Okay. So now we kind of just wanted to open it up for conversation, questions, thoughts, feedback that you have for us in terms of what we've shared with you, how we've been moving. I think both as an agency and with our investments in TSN and our community partners, and just kind of start the conversation for as long as you would like. Yes, Pete.
It's great to hear all this. I haven't heard all of it before, and the silo busing concept I've heard from Robin is a wonderful plan. From a public health and medical perspective, I would ask, how often do you see a need to prevent unintended pregnancy? How often does it happen? How often do you wish that you had a chance to do that in these various programs?
I think we've all seen a lot of the data for the unintended pregnancy numbers across the county, and they're particularly high in Longmont, and they're particularly high in teenage Latina youth, and that's a big area, and it certainly impacts later down the road. It didn't surface in the assessments of all the plans for the TSN investments as that happened, or the community meetings that we had following that. And I think some of that may have been that there were some funding already moving in that area. But we are exploring that as that's one of the sort of target areas for TANF expenditures as well. So we're thinking about some investments to meet that as well. So it's definitely an important area, and I think what we have heard, the feedback we've heard, is there's a lot of in-school education that needs to happen for teens, and services that need to happen for teens that would support the reduction in that process.
I'd add that the unintended pregnancy rate is 30 to 50%, and it's not just teenagers; it's every age.
Okay. We'll take note of that. Maybe you can give us some more areas that you think, ways we think we could hit that. Other questions, comments?
Frank, I have a question. Yeah. Can you speak directly to the numbers of basically young adults 18 through 25 in terms of the population here in Boulder County? We're seeing an inordinate number of those kids show up at our services, and just curious as to whether or not those are included in plans going forward or not.
So, do you want to speak to this area?
Oh, the question was the number of kids that are between 18 and 25, I think you said, and how many are showing up at the shelter, and what do we have any plans around that, basically. And so that group that's working on the transition age youth, that is part of the focus of that group, is that 18 to 25-year-olds, because of the way funding is structured for a lot of the agencies. The funding ends at 18, and then the requirements to participate in adult services have a much higher bar than they do for youth services. So it creates this gap for us in our community for those kids. So we have a committee that has been getting together and meeting with a lot of the community partners and really looking at how can we bridge those gaps better for our kids and use our funding sources a little bit more flexibly to be able to do that. And so when Casey Family Programs comes in a couple of weeks, that's a big part of what we're going to be looking at, is how to address that. And I think the other thing that we did, because we obtained the Family Unification Program vouchers, and those are available to any youth who was in foster care after age 16. They don't have to have emancipated from foster care. They just had to have been in foster care before their 18th birthday, between 16 and 18, and then we can house them up in these vouchers. And so we're right on the cusp of getting out to all of our community partners that touch that population, like your agency, and really get people educated to how to make referrals of those kids to us. So those are a couple of ways we're working on it.
And I can also follow up on that in some other ways. You know, what we saw when we looked at all of the plans was that the basic stability pillars that the community and the agencies need and have requested in terms of easier access to mental health and substance abuse treatment services, access to stability benefits, access to housing, crisis supports, easy access to medical and dental care, and those real pillars that we see, access to workforce development, that those are really common regardless of the population. So whether we're focusing on a senior population or a disabled population or a families at risk of placement or homeless youth, that really for us to move the system, we've got to push it. We've got to push it there and ensure that our services are accessible in those pillar systems. And I think from our perspective, and I appreciate Ann's number. When I came out of working with homeless street populations in Philadelphia. And back then, we were really I was working for a crisis-oriented agency solely. And what we did was really try to prevent death on the street. I mean, it was kind of that level. So we would go out in the middle of the night and wake people up and keep them warm and really focus on how to survive. There was a rash of homeless deaths on the street in the early 90s. But we also did an assessment at the same time of what was it actually costing the city that. And when you incorporated the mental health, substance abuse, emergency shelter, law enforcement, interventions, social service interventions, plus the nonprofit interventions, it was about $90,000 a year per person for us to basically wake somebody up in the middle of the night and give them a hot cup of chili. And so out of a lot of that thinking that's happened across the country, that's where some of the Housing First models have been born, and a lot of the sort of how do we move the system upstream where we don't have the crisis, and then our system is built so heavy on the back end, is really that transition to front end services. So I think in hindsight, when we started some of our child welfare redesign, we were talking about it in terms of reduction in placement, but really what we're talking about is focus on permanency and prevention and stability and family support. Because you don't just reduce placement, right? And you don't just reduce, you don't just triage youth homelessness. You have to figure out how to support youth and support the community. So, I think a lot of the ways that we're trying to hit the system overall is to touch on that, and I hope that there will be more. We know that the transition age youth population, that 18 to 25, is a really important one. We're considering different models in that 18 to 21 group within our own department, and we're certainly committed to not having any youth age out of our care without a permanent home and a permanent family to work on that, as well as our partnerships with the Homeless Planning Board. And I know many of you in this room are on the 10-year plan to end or reduce homelessness in Boulder County, and I'm sure this is going to be a topic going forward as well. And I hope that we continue this process of moving funding that we have. And many of us here, some of us run foundations, some of us work for cities, some of us work for the county. We all need to invest the dollars that we have to the interventions that really support these vulnerable populations before we have to build an expensive back-end system to catch them. And the more that each of us does that and moves funding, then it's not just like how do we use what's left of this one bucket. It's really an alignment of resources, and I know that's been happening through some of the strategic planning work, but we hope that the community will continue a lot of that effort, because we can serve a lot more youth with other supports if we can move upstream, just like we can folks, homeless prevention, than we can serving homeless folks that have penetrated deeply at the end of the system. Other questions or thoughts or comments or concerns or? You got, yes.
I guess just to follow up on that just a little bit, there still are the people at the end.
Oh, I know. I understand. Yeah, definitely.
And we probably all want to prevent everything. There's still going to be a few.
Absolutely. There still has to be a strong back end system. Absolutely. That's got to occur. But what we know from our agency's perspective is we have not been able to. We would have sunk if we had just maintained ourselves as a very strong back-end system and tried to handle the capacity that landed there. It just would have been overwhelming. And I know that we're all still facing folks that have fallen off the cliff and fallen deeper into crisis. And we've tried to fund a lot of those services with TSN investments as well through the emergency service agencies. So, and I think this is hopefully going to continue to be an iterative process. But again, what we know is that there's only so much of the community we can serve in that model, and the human cost of people ending up in that situation is so high. and really lifelong. You know, the costs then transition from system to system to system, and we've seen that a lot with youth that we end up in placement. They really their struggles continue on and on through the schools, through the workforce system, etc. Yes, Bobby.
As I look around, probably 75% of us are the choir. And gee, I so wish that more of the taxpayers that voted for this were here to hear about this is what you voted for and here's the impact. I wish that there was a way that we could get this information out. And then my only other comment is when you talk about parent engagement and support, when you're talking about working with the school districts, don't forget the birth to 5 population who are not yet covered underneath the school district. So since that's our population, I would love to talk to you about getting information out to those parents.
Absolutely. Yeah, and just in relation to Parent Ed, what my comment was that as we've been trying to see how we can support the truancy reduction efforts of the 2 school districts, that has been what they have identified as something that they need support with. But we see it, you know, our most vulnerable kids penetrating child welfare are obviously in the infant 0 to 5 range. That is when we have situations that have fallen out of control at that level, very traumatic and oftentimes require deeper intervention. So Parent Ed, I think, regardless of the age of children, is a massive issue for us as a community, and it's really it's a really low cost per person intervention, but it does have huge implications. One of the things we've tried to do is we've really shifted. I think Jennifer mentioned this before, but we've really shifted our financial management classes. One of the things that we identified through the TSN planning process was that the way that we were providing education to families on financial stability, which was effective, but it wasn't hitting the right groups of families in the situation that would assist us in stabilizing them. So we've really tried to shift that continuum again deeper down. So basically much more basic levels, and for people that are much deeper in crisis earlier, and then move them up to the education that we had developed. And I think some of our Parent Ed does face some of those same problems. You know, there's a gap sort of in what's really needed to support versus what we're providing. Yeah, Gary.
Yeah, it seems really important to get the word out. You know, when Deb and I are out working on our political campaigns, we're lauding this program over and over again. And people ask us a lot of times, well, is this something that we want to renew? So my question to you, Frank, is, you know, I think it's really important to help people understand that you just didn't use this funds to use a Band-Aid to, you know, prop up some of the direct services you provide. You looked at systematic cultural change and how you provide services. So if you think about it, it's a long-term effort, continuous effort. Are you thinking anything around TSN 2.0, or, you know, what's strategically further down the road you've thought about?
Well, I think it's too early for us to talk about 2.0, in my opinion. But I'm not the ones that gets to decide that. I think from our perspective, when we went and we had conversations. This TSN was really built out of some coffee table conversations and then some coffee table conversations with people who have nothing to do with our system. And the community response back that I heard over and over again was, our neighbors are falling into crisis. And we see, every one of us constantly sees and knows people who are facing difficulty. And we know how demanding the support needs are right now in the community. And we want to support you, but we want to see that investment produce. And we want it to be well defined, with a clear purpose, and with a limit. And so that limit has been set upon us as a community and as an agency of that 5-year window. And that really came out of a lot of those conversations around, well, how long do we think the economic downturn's really going to go? What can you really do? How will you knit each other, better? What will we see are some of the tangible outcomes? So I think, at least for us, that's been our focus. And I think on the other side, some of the great progress I think our community has made is that the funders are all meeting, so that the key foundations and the city and funders and the county funders are meeting to really look at how they allocate and invest dollars in a very similar approach. And I think with that kind of alignment and then some of the outcomes that I think are being achieved, then you can kind of ask that question, when's the appropriate time? But I would ask you to ask me that in 2014. Yeah, Ann.
One of the things, we've been crunching all of our numbers, and one of the things that I've noticed is that it kind of goes to the dosage issue, is how to, I think that services that are emergency-based are pretty used to, it's kind of a hot potato. So we do emergency thing, we pass it on, and to slow down that process to actually allow families and individuals a moment to kind of gather themselves, and then for the advocates or for the resources to figure out what is the best solution or service for that family is taking longer, takes longer. So in our emergency shelter, we saw a 15% increase in length of stay last year, which just put some perspective around that. On any given year, we typically turn away about 300 calls for emergency shelter because we're full. That 15% increase translated into turning away 700 requests for emergency shelter. And in our organization, we're really struggling with, we've slowed down the process. We're not just cranking people through shelter, transitioning them onto another shelter. It takes time to figure out what's the most appropriate next step housing, and for that housing to be available. But the end result is that the backlog of folks whose lives really are spinning into crisis is going unmet. And I think I see it really as it's a consequence of tweaking this system, and I do think that it would be helpful for the providers, for us to really to kind of deconstruct what do we see, what are some of the trend shifts because of this influx of sort of collaborative dollars. We're working better together, but it's taking longer to do that. I don't think what we want is sort of a two-class need community where people who get in the door and then sort of get all of us wrapped around their lives helping them, and then the folks that never actually do get in the door and simply spin into crisis.
I had another question. I see mostly families from Mexico at People's Clinic. 2/3 are Spanish speakers. And I often think about, we had the Hmong in the 70s, and we had a little period with Bosnians, and they have jobs now, and they moved on. They don't come to the clinic. And there's a process of getting your feet under you, learning English, getting a better job, of adult education, and so on. And I've never seen any systematic thinking about the way in which our families who immigrate here are taking these steps to move up, and the ways in which we could help them. Just thinking about them as a group and the challenges that they face, the isolation that some people feel, versus having friends and family here, the losses that they suffer from leaving their family behind, the gumption and ambition that they show by coming here. I've never seen anybody write or talk about that, and I'm very curious.
And maybe I can go back to your point. I think the interesting thing is you kind of need to be able to do both. And how does the system handle that light touch? I mean, if you're talking about 700 last year when you only had a 15% increase, you have also a huge increase in calls simultaneously while your caseload time requirements have gone up, basically, right, is what you're explaining. And I think, that's kind of what we try to grapple with all day long, with the tens of thousands of people that are coming in, and how do you figure that out? So, I'd love to talk through with you about what are some additional ways that there might be ways that we could support that process, because I do think it is a combination of having to figure that stability focus, so it doesn't just bounce from agency to agency, as well as then doing the light touch for those that can. And so what you've seen in some of our system is that we've really decreased some of the deepest expenditures and deepest human cost programs and penetration into that area, and been able to place those families into lighter touch, more appropriate services. But we've also, by that process, the families that really do deeply penetrate, which there still are, of course, right? I mean, that's always going to happen, require a much different level of intensity on our end as well. So there's a different workload issue per family than there used to be. So we may only have 80 children in placement, but the intensity of the requirements to support those children in placement, and then the families that still have their kids at home, but we have a lot of intensive in-home services, is very different. So it is sort of an interesting concept to think about community-wide, because if you look at the community data overall, there's a huge new population, probably more than 2x what we were dealing with 3 years ago as a system as a whole. And how do we mitigate that and think that through? And I think some of the, like us beginning to allocate unit resources to you, housing resources, overflow resources, that in that way are some of the ways that we could kind of build on. In terms of what you discussed, what are you wanting feedback from the group on there? Did anybody have any thoughts on that?
Well, I think there are some wonderful organizations in the community that are, Intercultural comes to mind, Community. I think there are a number of groups that are working for certainly one of the challenges I think in all of this is really the services that are available to undocumented folks, and that's not something that we can locally solve. So they say. We'll see. But I do think it's something that, as you're saying, that we want to kind of keep on the radar. So again, that we don't create sort of subclasses of people who need services or need livable wage employment and don't have access to it at the same rate or the same way that other folks do.
Other comments, questions? Anything?
Let's figure out how to connect human services and GMO. And then we'll have this room filled in arms about our food situation. So maybe instead of talking about salmon, next time talk about GMOs.
Talk about sugar beets. All right. Do that. Yeah, sure. And what we would like to hear, if people do have suggestions for things you think, are we on track, or would you like to see us do things differently? I mean, we really are hoping to get that from you. Yes, Terry.
Yeah, a couple thoughts. One is, kind of what Bobby was saying a while ago about getting information out about what we're up to here, because it really is tremendous work that's going on across the community. But do it not so much from a marketing perspective and focus, more of a community engagement focus. The work that we're doing, I think, is just going to be even more overwhelming in the future. But one data point, we're looking at 10 years out. You look at the 25 fastest growing jobs in Boulder County in the next 10 years between 2010 and 2020. 30% of them pay good wages, above the median. 70% of them pay below the median. They're projected to grow. And the median is just about the self-sufficiency wage for a single mom of 2. So that push in of itself is going to mean that we're going to be seeing more working poor coming to you, coming to us, and that is one hell of a battle to fight. in an environment where your programs are going like this and nonprofits are going to be called upon to do more. So I think call to the community. It's not so much let's do 1A version 2.0 as to how do we engage people and educate and inform them about what they can do, you know, to pitch in a bit. So that's part of the strategy I think we need to collectively develop somehow. I don't know what that is, whether it's foster care or, you know, working with kids that are aging out or homeless families. Or we've got to somehow get traction on that piece. And that's not a strategy that's up here yet, the engagement strategy.
Yep, the economic development.
Oh, well, the economic development piece, I mean, that's the State Department of Labor saying that's the job growth in Boulder County.
Yes, but they don't know how good we are here and what we can do when we know that we're heading that direction. Course correct.
Let's hope so. The economic development piece has to be linked to it.
It has to be, yeah.
They're saying it's happening here.
It has to be. Workforce development's huge. Yep.
Oh, I second that. It's just getting the community engaged more in what we're doing and how to do that and how to make those communications happen. Just a logistic question. I missed on your timeline. When are the next rounds of your funding coming out?
Well, we're planning for those other priority areas that we did not release funding yet to be going out, I'd say, sort of fall, late summer. Yeah, summer to late fall. It kind of depends really on the assessment and how much work there is to do. But we'd like to get it out as soon as possible, as soon as it's better defined, those other areas. But the contracting work that you've seen in those numbers, for many of those agencies are under contract for a couple years, and other contracts are just being put in place this month and next month. So a lot of the money is already contracted out.
Just want to say briefly on the communications piece and the transparency piece, Bob, I hear you on that, and I think we're really committed to that with the community to really tell the story. We're just starting to get to a point where we're starting to see some outcomes of the investments. So we brought Jim Williams on board, and we look forward to working with you to really get the word out to the community. It's something we've really focused on, the programmatic piece in putting our investments there, and now we kind of have the ability now to step back and bring someone on like Jim with his expertise to help start to tell the story and get the word out to the community. So we're committed to that, and I look forward to working with all of you to get the word out.
Okay, anything else before we wrap up? Really?
Yeah. Well, as an immigrant 40 years ago, I went through the experience of being out of the country, and we had the Committee to Aid American War Objectors, but I don't know that that would be apropos to what you were talking about.
Okay. Well, if there's no other comments, then thank you for coming, and grab a cookie on the way out, and we'll talk to you soon.